Welcome to what is the first and what is hopefully a series of lectures that we are going to be giving to help you have a better understanding of Scripture and to answer some questions. This particular question was one that was posed to me by Freed-Hardeman University, which is my alma mater, and I was asked to speak on this topic in relationship with the Freed-Hardeman Lectures. This particular topic was given to me because it touches some of the different areas which I'd like to think I know something about. As you can see there, in addition to being a preacher, I also am a physician. I'm an internal medicine physician, and I work primarily with the elderly. In that work, one of the things that I do is I treat people who have a history of heart disease and anemia and some bleeding disorders. And because of that, someone thought I would be an appropriate person to speak on this particular topic. Did Jesus really sweat blood? Well, I'll encourage you, if you have your Bible handy, turn with me to Luke chapter 22. Luke chapter 22. And we'll start reading in verse 39. And he came out and went, as was his custom, to the Mount of Olives. And the disciples followed him. And when he came to the place, he said to them, "Pray that you may not enter into temptation." And he withdrew from them about a stone's throw and knelt down and prayed, saying, "Father, if you are willing, remove this cup from me. Nevertheless, not my will, but yours be done." And there appeared to him an angel from heaven, strengthening him. And being in agony, he prayed more earnestly, and his sweat became like great drops of blood falling down to the ground. And when he rose from prayer, he came to the disciples and found them sleeping for sorrow. And he said to them, "Why are you sleeping? Rise and pray that you may not enter into temptation." So when we think about this question, did Jesus really sweat blood? I've broken it down into three primary considerations that we need to take to answer this particular question. So the first thing is the biologic and pathophysiologic questions and considerations that we have to answer. As I kind of mentioned before, I'm pretty convinced this is why they asked me to talk about this. I get paid to do things related to this, so at least you know something about it. And I'll, kind of a spoiler, I think that's the easiest question of these three. The second set of considerations is related to textual criticism. So textual criticism is an idea of determining what the text said that was originally sent from the hands of Luke in this particular case. If you have your Bibles, I'm using the ESV. It has a little footnote in my Bible. It's footnote 4. Some manuscripts omit verses 43 and 44. That's not a small detail, and I think it's something that we really need to take into consideration. Last, some linguistic considerations. So the word that we are really concerned about is what we have here in verse 44, where it says, "became like great drops of blood." That word has been debated if it means something along the lines more of became actual or mixed with great drops of blood. So we'll get to that here in a minute. But the first thing I want to pose to you is whenever we do this study, we really are looking at two things. Does it happen versus did it happen? I think the first question is an easier one to answer whenever we think about the topic of can people sweat blood? But I think it's just as important, and this is really the last two considerations that I listed, is not only does it happen to people, but did it happen to Jesus? So we'll begin with the biological and pathophysiological considerations by looking at a sweat gland. So whenever we consider sweat, you have two primary types of sweat glands. The eccrine glands, which you can see pictured there on the left, and the apocrine glands, which are pictured on the right, or apocrine. You'll find out in medicine a lot of things are kind of potato-patata type things. Now this is a schematic, and it does have a few things that I think that are a little bit important that are missing. This was the simplest image I could find. If you look, both glands do not have capillaries around them. This is one of the important things for our discussion that you need to know, is that there are capillaries that are in a way sort of filtered through the glands and become what ultimately is our sweat. The eccrine glands are the ones that we find most of our body. Whenever you think about when you run, how your back will get drenched, your sternum will get wet. That's mostly eccrine sweat. Apocrine sweat is primarily the type of sweat that doesn't smell very good. Those glands develop more in puberty, and they're located mostly in the axillary region, that's under your arms, in the inguinal region, that's kind of between your legs, and kind of a strange one that is relevant for our discussion, the temporal region, which is on the sides of your heads, what we think of as your temples. Something that's missing also from this is something called the piloerector muscle. These are very, very, very small muscles that are near the hair follicles. And these become tightened and contract whenever you're in times of primarily being cold. But if you've ever gotten so scared that you've gotten goosebumps, they can also contract in times of great stress and fear. That's going to be relevant here in a second. So I'd like to pose another question for you, one that you may have never asked yourself, of why don't we just bleed out? You ever thought about it? You probably have brushed your teeth a little bit too hard and gotten a little bit of pink on the bristles. Well, that's blood. Why don't you just continue to bleed? Why does it stop? Why don't you, whenever you, say, scrape your knee, why doesn't it just keep oozing and oozing and oozing? Well, God blessed us with a series of checks and balances that we call as a whole the wound healing process, that consists of a few different areas. For our consideration, the two main things we're going to be talking about are called primary and secondary hemostasis. But whenever you cut yourself and there's endothelial damage, so that means some sort of damage to the vessel, that can be either from some internal problem, like if your blood pressure spikes, it can actually damage the vessel. That's why we make such a big deal about controlling your blood pressure. Or if you cut yourself from the outside, you can injure a vessel. The first thing that happens is vasoconstriction. So vasoconstriction occurs in order to kind of temper the bleeding, literally. Whenever you think about your body and your circulatory system, in a way, they're a series of pipes. And you'll bleed out more slowly through a small pipe than a big pipe, assuming the pressure stays the same. So one of the first things that happens through a series of neurological connections and through some hormonal signals, our vessels constrict. They get smaller. This does a few things. One of them is it approximates the edges of the injury, which makes it a little bit smaller of a hole to bleed out of. And it decreases the blood flow to the area that's in question. The next thing that happens is a platelet plug is formed. A platelet plug is, think of it as the initial blood clot. Platelets come, they get activated when you cut yourself. We're going to talk about how that happens in just a second. The platelets get activated and they try to fill the hole that's left open. The next thing that happens is you form a little bit thicker clot. Um, this is a fibrin-rich clot. Sometimes we think about this as a thrombus. If you ever heard of a DVT, that's a deep vein thrombosis. This has got both platelets and some other proteins in it to make it more stable. And after that occurs, remodeling can occur. With primary hemostasis, whenever that endothelial surface is injured, a compound called von Willebrand factor is exposed to your bloodstream. This causes the platelets to get, for lack of a better term, sticky. The sticky platelets cause other platelets to stick to them. You can see there that's the GP2B3A receptor gets activated on the platelet that causes other platelets to attach to the first platelet. And you get a clot that forms and takes up, hopefully, just the vessel. In case you were wondering, this is basically the pathology behind a heart attack. When one of your coronary vessels becomes injured and a platelet goes to that area, von Willebrand factor is exposed, the platelet gets sticky, it tells all the platelets around to come, and because your coronary vessels are not very big, the clot eventually takes all of the circulation and cuts it off to the heart. That causes a heart attack. So whenever this thing is doing what it's supposed to, it's helpful. However, in the wrong situation, it can actually harm us. These are used as the initial healing that typically is fairly short-lived before the more permanent clots formed. If you've ever had a small paper cut where you don't really disrupt the basement membrane and you never really see a scab form, sometimes that's a total primary hemostasis healing process. Your teeth are another example. Like I said before, when you brush your teeth too hard, that's mostly platelets. You can always do things that make it more of the secondary hemostasis that we're going to talk about, but as a typical rule, that's mostly platelets. As an aside, whenever you look at this, our therapy for things like preventing coronary disease or strokes or peripheral vascular disease, they're aimed toward these things. So one of the things we do is we decrease the ability of the platelets to stick together in order to help prevent heart attacks. A fairly common, it's a little bit newer medicine, but a fairly common medicine is called Brilinta. It's used typically after someone gets a stent placed. It inhibits that GP2B3A receptor and makes it so it doesn't work correctly. By doing that, it decreases the ability of your body to aggregate platelets, because after you first put a stent in, it's very likely to have clots form in that area. So we want to prevent those typically for a year. Platelets also are affected by aspirin and another medicine called Plavix, which the generic for that one is called clopidogrel. They also affect this process. So this gives you some idea of how we prevent this from acting the wrong way. So that's primary hemostasis. Secondary hemostasis here is governed by something called the coagulation cascade. I tell people that this is the bane of the existence of most medical students. This has a few different things that are valuable. If you ever knew somebody who's on warfarin, Coumadin's another name for that, it inhibits factors 2, 7, 9, and 10 in this pathway. Those are what we call the vitamin K related factors. I'll tell you that if you want a really good argument for irreducible complexity in our body, I think the coagulation cascade here is a great place to look. Another aside, it's kind of an interesting thing for not necessarily this discussion, but for an apologetics argument in general. If you remember, whenever a Hebrew boy was born, they were instructed to be circumcised on the 8th day. Now, why is that relevant? Well, we know now that vitamin K does not increase until the 8th day. Vitamin K is primarily made in humans by the bacteria that live within our large intestine. Whenever we get to that 8th day, we've developed enough to have vitamin K levels that are compatible with doing this particular set of steps. Until the 8th day, if you were to circumcise a young male baby, there's a good chance that they would bleed out. Just a few other fun facts. So, the medication Xarelto is a 10A inhibitor. You see that 10, Roman numeral 10 with a subscript A. Xarelto is spelled Xarelto. So the name comes from the fact that it inhibits factor 10A. There's many things in medicine like that where it's a pun that only doctors get. The thing that I would like to point out, and the reason why I went through all of this, the particular pathology that is important for our discussion, it does not have any problems with everything that we just mentioned. The vasoconstriction is normal. Primary hemostasis is normal. Secondary hemostasis is normal. And you're able to maintain the remodeling process. So this pathology, hematohydrosis, has been reported in antiquity. The first time it was described was by Aristotle, about 3 centuries before Jesus. And at that time, he was describing it primarily in animals. So he says, instances and deeds are not unknown of persons who, in consequence of cachectic state, have secreted sweat that resembles blood, and that's from parts of animals. And then here in History of Animals, if the blood get exceedingly liquid, animals fall sick, for the blood then turns into something like ichor, or a liquid so thin at the times has been known to exude through the pores like sweat. Charles IX of France, during the end of his life, experienced a phenomenon where blood seemed to come out of every outlet in his body, and including his pores of skin there. There is a question with this particular situation that it could be something called DIC, that's disseminated intravascular coagulation. That particular disease is seen more often than hematohydrosis, and it's usually associated with your body having so many clots in so many different places that it doesn't have any platelets or clotting factor left to use. And we do see it in people who are very, very ill today. Sometimes people will bleed from their IV site. That's a pretty common association. But it at least has the suggestion of this particular process being identified in the past. A few more, George Sporlin, he was from Basel. He reported in a 12-year-old with a high fever. 1628, Paulo Zacchia reported in a young Belgian who was condemned to die. And this is one of the first times this was associated specifically with stress. Kind of a strange part of the history of this particular disease is Gerard van Swieten and Felipe Pinel, uh, this is proof that men write medical textbooks. They believed that pieces of the uterus were somehow in the skin because of the suppression of menstruation, which led to this process happening. My little commentary on this. Yes, we look back and this does seem like a pretty dumb idea. There are a few different diseases where uterine tissue can deposit in places other than in the uterus itself. So they're not crazy, but I'm not sure if the reason why they had this idea was necessarily totally a pure thing. That maybe a little bit of sexism involved. And then we have De La Tourette here. He is the one who said hematohydrosis seems to be a product of some sort of psychogenic disease. He's the first one that not only suggested it, he said it is. In modern medicine, hematohydrosis is the disease that has been a little bit controversial. Sort of a strange process happened, and through the evolution of the history of this disease, at some point, it became something that was more popular in the discussions around it theologically than it was in medicine. It started out as something that was described primarily by doctors and other scientists. At some point, it was picked up by theologians, and then since then, I think primarily so that modern medicine would distance itself from what at least appears to be something superstitious, it was taken out of a lot of textbooks. There were two, Rook's Book of Dermatology. It was stated to be a rare disease, but it is actually taken out in the 2007 edition. And then in 2012, we see here that in Textbook of Dermatology, it was considered as sort of the sweat glands, but they still left in, it's not been confirmed scientifically, although they didn't deny its existence. So this is sort of where it was in limbo, although recently, as you can see, there's been a lot more thought of, yes, this is something that we can pin down kind of what causes it. So one of the things that seems to be common among all these cases is there's no bleeding disorder. It responds to a drug called propranolol, which is a drug that affects the vessels and makes them constrict less. And it's usually associated with times of intense stress, mostly emotional. I bring up the propranolol acting on vessels and relaxing them, decreasing vasospasm. Propranolol is a drug that originally was studied for blood pressure. It's not very good at that. It then was used for some heart-related problems. It's not very good at that either. In fact, today, the most common reasons to use that particular medication are chronic headaches due to migraines and familial tremors. The fact that it's not selective and doesn't specifically target the heart makes it a little bit tricky to use in medicine, but it makes it good for this particular disease because it doesn't only affect the heart, it affects all the vessels. Through the cases, and the two cases that we're about to see, it was determined that there are 3 primary criteria that must be met in order to make the diagnosis of hematohydrosis. So the first one, you have to have recurrent, spontaneous, painless, and self-limited oozing of bloody discharge, and it's witnessed by and confirmed by health professionals. I really liked this one because this basically says, unless we see it with our own eyes, we won't believe it. This is kind of the doubting Thomas diagnosis, if you will, that it's so uncommon that they made it part of the diagnostic criteria that a medical personnel actually has to see it. Second, the usual blood components are found in biochemistry studies of the discharge. Basically, it can't just be red, it has to actually be blood. So they send it off to confirm that it's blood. They look for the components, things like hemoglobin, and if that's in there, you get to tick off that one. And the third one, the site of bleeding is intact with no abrasion, so it's not had a scrape on it, a telangiectasia. That's kind of like a collection of blood vessels that can burst, or purpura, it's a fancy word for a bruise, after wiping the area, and there's no evidence of oozing. All these criteria must be met in order to rule out organic bleeding disorders, self-inflicted bleeding, fictitious disorder by proxy. That's whenever someone abusing someone causes something to appear this way. And chromahydrosis, which is the blood being red, not necessarily blood, because there's other things in our body that can be red. So here we have one example. In a 13-year-old boy, this is from an Indian journal, and you can see here that the blood's present. The picture on the left is his face. The picture on his right is his arms, and it's a little bit hard to see, but I can assure you that there are no cuts anywhere near this. Second, and this is the one where I said this will kind of be relevant. If you look here, remember how I said the apocrine sweat glands are primarily on your temples? This bar, to hide your eyes, covers it up a little bit, but if you look, that area that I was discussing really isn't affected by this. You can see some of the other areas, at least where I sweat a lot, in my forehead. Fair amount of blood that was seen in this 21-year-old woman. So, my opinion, you can disagree with it, to answer our first question, does this happen? I believe it's a resounding yes. Yes, it does. That brings me to our second question, or second consideration, textual criticism considerations. So, what do we have in front of us? Well, Luke 22, 43, and 44, it's omitted from several of the older manuscripts, and we'll get to this in a second, but some of the important ones particularly. In other areas, it's transposed to follow Matthew 26, 39. I don't know what your familiarity is with textual criticism, but a text that gets moved is kind of a no-no. The people who put together the eclectic text really don't like that. Another example is the pericope adultera, which is the passage from John that describes a woman who is caught in adultery. That is another passage that has a lot of scrutiny toward it because it's found in multiple places. In addition, there are some manuscripts that include the passage, but they have a mark. Not many of these have an explanation as to what the mark means, but the assumption is, since other places don't have the mark, and it does, that there is at least a question about the particular passage. So, looking at how different versions handle this passage, The King James, the New King James, they follow the majority text, and they include it with no particular changes to it. The American Standard, English Standard, New American Standard, Christian Standard, NIV include the verse in the text, and they place a footnote, as mentioned before. The New Revised Standard and the Net Bible do something a little bit different. They place the text in double brackets, and they have a footnote saying, similar to what we read earlier, that these are omitted from several manuscripts. The RSV, which you may know as a version that was particularly controversial, it does not include it in the main text. It does have it, but it's listed in a footnote later. So what does the manuscript evidence show? Well, a few here that you may recognize. P75, considered by many one of the most important papyri. It's usually given the date from 175 to 225. Includes some of the earliest information from John. A there is Alexandrinus. B is Vaticanus. N, I'm going to completely butcher this again, but Petropolitanus Purpureus, which is one of the purple uncials. You may have seen those before, where the actual manuscript is purple in color. One that I didn't mention specifically in the notes there, but an interesting one. If you look there, Aleph, it does kind of a strange thing. You see how it's 2 Aleph A. What appears to have happened, and the way this is usually described, it appears that you had initially someone have the text included. Then there seems to be a second corrector that omitted it. And then there's a third corrector who put it back in. It's another one of these that has that mark that I mentioned before. So some of the most important manuscripts that we have, at least draw this into question. And UBS 5, the United Bible Society, 5th edition, their overall kind of gestalt of what we should do with this is they say omit with an A rating. So some important kind of notable comments that I found in this study. Westcott and Hort, who they did the eclectic text that became the basis for the translation for the American Standard Version. They said it was an early Western interpolation adopted in eclectic texts. So, casting some doubt on it early on. This is a quote from Alfred Plummer that says, "One thing is certain, it would be impossible to regard these verses as a product of the inventiveness of the scribes. They can only be a fragment from the traditions, written or oral, which for a time at least locally currently beside the canonical Gospels, and which doubtless include matter of every degree of authenticity and intrinsic value." So Plummer here, in a roundabout way, he's saying that I don't think this is actually part of Luke. However, I'm confident that it's a real story that was later added to the text from tradition. Kurt Aland, notable as the A in NA28, the Nestle and Aland Greek text, he says these verses exhibit a conclusive clue to their secondary nature, like the pericope adulterae that I mentioned earlier, in the alternative location for its insertion. While the majority of the now known manuscripts place them at Luke 22, 43, and 44, they are found after Matthew 26, 39 in the minuscule family 13 and several lectionaries. This kind of fluctuation in the New Testament manuscript tradition is one of the surest evidence for the secondary character of a text. Another important textual critic, Bruce Metzger, he says, these verses are absent from some of the oldest and best witnesses, including the majority of Alexandrian manuscripts. It is striking to note the earliest witnesses attesting to the verses are the three church fathers, Justin, Irenaeus, and Hippolyticus, each of whom uses the verses in order to counter Christological views that maintain that Jesus was not a full human who experienced the full range of human sufferings. It may well be that the verses were added to the text for just this reason, in opposition to those who held to a Docetic Christology. Docetism was a belief that when Jesus came to the earth, he wasn't fully human. He was a spirit, or an illusion, kind of like a ghost. I'll give you my notable comment from Theodore Woodward. Don't look for zebras on Green Street. This is a very important phrase to doctors. We use this phrase to kind of keep us grounded. Green Street is located in Maryland, where the University of Maryland is located. And Theodore Woodward was a teacher there. And he told his students, whenever you're thinking about diagnosing things, don't look for zebras. Another way this has been phrased is, if you hear hoofbeats in Baltimore, think horses, not zebras. Well, here's my comment. This particular disease process is a unicorn. It is very unlikely that any physician will see this in their lifetime firsthand. The pictures I showed you earlier, those are all from the last 10 years. This is something that's incredibly rare. It virtually never happens. It's so uncommon that people argued that it didn't exist for a long time. I cannot see a way that a scribe would have witnessed this phenomenon and placed it into the text. So while I can't account for everything, I do think it's an important thing to note. So there really are two sides to whether we should have the verses in the text or whether we shouldn't. So to be fair, I've laid them both out. I don't honestly care which way you think, but I want you to have all the information. So what are some explanations against? Well, the first one is they're embellishing a story from oral tradition to make Jesus look, more of a hero, if you will. We like whenever we tell a story to make it sound a little bit better. We try to play it up so that we make it sound good. And this argument says that the early Christians were using this to make Jesus appear to be in even more pain than what he already was. Second, as a general rule, scribes tended to add to, not take away. So in a case of doubt, you left them in. One argument from a gentleman by the name of Bart Ehrman, which you may have heard of, and Plunkett, he said that these words were added as an anti-Docetic improvement to the text, that this is from Orthodox Corruption of Scripture. He said that these were purposely added in the discussion that Metzger was having earlier to combat this heresy of Docetism. As you can see here, that's the belief that Jesus' body was not real or it was a phantasm. On the other side, the defense of the validity of these verses, as I mentioned in my little argument, there's no good explanation for these verses other than them being authentic. There's no way really to account for them other than them being the real thing. This isn't something that you could really make up. Second, angels are a theme throughout Luke. Angels coming to Jesus, this has been something very common throughout the book of Luke, and this is in keeping with that theme. Another thing to think about, we were talking about scribal changes. Well, another possibility is something that's often labeled as harmonization by omission. So the idea is these two verses are exclusive to Luke. So if a scribe had just finished copying Matthew, then copying Mark, he gets to Luke and he has this set of two verses that's very different than what was recorded in Matthew and Mark. He may think that it doesn't belong and therefore omits it. So this keeps it in line with the other two synoptic gospels. And last, there's this one argument made by a gentleman by the name of Blumel. The reference is there at the bottom. He said that he believes that it was removed due to Jesus appearing too weak. That the idea of Jesus needing to be comforted by an angel, being in agony, weeping till he sweat blood, these were all things that would have been embarrassing when compared to many of the epics that we see, particularly in polytheism and pantheism, that their gods were always portrayed as these strong, untouchable beings, and having Jesus look weak in the garden was something that would have been embarrassing. Therefore, it was removed. I don't know how much I buy into that, but it is at least something to consider, that while there's reason to think that the scribal errors may be additions, there's also valid reasons why they may have been removed. The last considerations we're going to look at are linguistic considerations. So the important word is Jose. This particular word, this definition is from BDAG. It's a marker denoting comparison primarily. So similar to our word as or like, if you remember from grade school, that term simile, this is kind of a marker of a simile. It also can be used in approximation with numbers and measures. I tell people this is the preacher count number. So whenever the preacher looks out across the auditorium and he says, "Oh, it looks like there's about 70 of us here," even though there may be 40, that's kind of how this word works. Whenever we're told at the beginning of Jesus' ministry, he was about 30 years old. It's this word. So we're going to be focusing primarily on that first definition, because that's sort of the area that's relevant for our particular study. So the first mention of this verse that I want to look at is in Matthew 3:16. The parallel passages use this word too, but this is the particular one that I wanted us to take a look at. So, "And when Jesus was baptized, immediately he went up from the water, and behold, the heavens were opened to him, and he saw the Spirit of God descending, Jose, like a dove, and coming to rest on him." Now, as you probably are aware, artist renditions of this usually have the Spirit depicted as an actual dove. And the idea of coming to rest on him is usually portrayed as a dove coming to sit on his shoulder or something. While I don't argue that that is within the way that this reads, it's not completely necessary. The idea of it coming down as in falling from the sky or coming down from the sky doesn't mean it actually had to look like a dove. It's the way it descended. So saying that this means that it became a dove, I'm not saying it's completely wrong, but it is a little bit of a stretch to say that it became a dove. Still in Matthew, chapter 9, verse 36, when he saw the crowds, he had compassion for them because they were harassed and helpless, like, Jose, sheep without a shepherd. So here we see pretty definitively they hadn't become sheep. It was a comparison. Acts 2:3, and divided tongues as, Jose again, of fire appeared to them and rested on each one of them. So this is another example where every single artist rendition I've ever seen of this, it was literally fire that was resting on them. But you can at least see how this could be something more of the method than literally becoming fire. Acts 6:15, and gazing at him, all who sat in the council saw his face was like, Jose, the face of an angel. Acts 9:18, and immediately something like, Jose, scales fell from his eyes, and he regained his sight, then he rose and was baptized. So once again, something fell off of his eyes. Were they scales? They weren't fish scales. We can say that confidently. But a lot of you are probably aware your skin can scale similar to what we see on a fish. So my opinion is there's enough of a mixture here that I think you can make a relatively good argument for either. Particularly whenever we look here in Matthew 3:16 and in Acts 2:3, I think you can at least get the impression that it was something literal. Acts 9:18, you can also get that impression. But to say it strongly means that his sweat became blood is difficult, but I definitely think reasonably within the meaning of that. That Jose, I think, could potentially have that meaning. One other thing that I found just kind of odd, why would you say as blood versus any other particular liquid? After my study of this, I'm convinced that no commentator has actually seen someone bleed a whole lot, because they were comparing how much more you could bleed than sweat. Without getting too graphic, by its nature, blood is generally more viscous than sweat is. So I don't think that argument holds much water. Something else that kind of, I don't know if complicates this, but something at least relevant. There are two hapax legomena. Those are words that only appear once in the New Testament in this particular set of verses. Hydros is the word that we translate sweat. Thrombos is the word for drop. I also saw that some people translate it clot. I question this just a little bit. I think this is a little bit of us reading a definition that we use now back into this word. The word thrombus, the word for clot that we use today, is a collection of platelets, and that's what makes it that way. It doesn't really mean clot in the first century. That's not something that typically it was used to apply to. So I personally think when this word is being used in this context, it does mean drop. So a few notable comments on these words. Henry Alford says, the intention of the evangelist seems clearly to be to convey the idea that the sweat was, not fell like, but was, drops of blood, and in his word, i.e. colored with blood. For so I understand the Hosea as just distinguishing the drops highly colored with blood from pure blood. So he's arguing that there's a mixture, and it wasn't all blood, but it was like blood because it was mixed with sweat. One other note here, this is from Howard Marshall in his commentary on the Greek text from the NIGTC series. He says, omission in so many different branches of the tradition is hardly due to accident. Nevertheless, it's hard to believe that the pericope is pure invention, and those who reject the verses from the text argue that they have been drawn from floating tradition, which had not found its way to the synoptic tradition. On the other hand, it can be argued that the verses may have been excised for doctrinal reasons, and that their thought likewise fits with Luke's point of view. So, one of the things I want us to take away from this, if you want to know my concluding thoughts, I'm not sure if we can say for sure. It's a little bit vague. I think that there's good arguments on both sides to support whichever position you hold. But here's what I want you to take from this. A lot of times this particular passage has been used to try to make Jesus's death seem so absolutely gruesome and terrible that there's no way that anyone else could ever experience anything like it. I'm not convinced that's what's trying to be conveyed here. I think what we learned from the garden is that we can see ourselves in Jesus. Something I didn't mention. Most of the cases of hematohydrosis have been reported in young girls, usually under 13. And many of them are children who have lost their parents. See, whenever we think about stress and agony and mental pain, one of the takeaways that I think we should get from this passage is that the way something affects you, if it's stressful for you. People don't get to decide what is and what isn't stressful or harmful or agony. That's true to you. The people who have hematohydrosis, it's not from the degree of stress, it's due to the degree of response to it. And what we're seeing here is that Jesus has been pushed to his wit's end. Whether or not it's to the point where he sweats blood, I think isn't the important thing. The fact that he sweat so much from stress alone in and of itself is something that I think we should learn from. Every one of us either has had or is going to have the most difficult experience in our lives. And what we should take away from this, what we should see in Luke 22 in the garden, is that Jesus did too. And we serve a risen Savior who suffered like we do. And that whenever you're feeling at the lowest point that you can feel, remember that Jesus did too.